So we're just at 6 o'clock now, so we're going to make a start. So first of all, thank you for coming along to our first workshop on supporting our young people with obsessive compulsive disorder. So this is being run by the Psychology in Schools team. And just before we sort of get into this workshop, we've got a few sort of introductory slides that we just would like to go through with you. So we've just got a slide on here, just a bit about confidentiality. So we're going to be using Slido today, which is our sort of main interactive tool that we use in these workshops. We're not able to sort of answer direct questions from you or talk to you on these workshops, unfortunately, but that's why we really like to use Slido, because it's a great interactive tool and a great way for us to be able to sort of interact with you and for you to be able to interact with other sort of carers or parents on the call. But please just be mindful when you're answering questions on Slido not to include any personal or sensitive information about your young people, such as names, or sort of schools or anything that can identify you or your child. Slido is anonymous, so we won't be able to see who's putting what on there, but others will be able to sort of see what you've written. And also, just sort of off the back of this, we do record our workshops and they are later uploaded onto YouTube, so just please be aware that anything said on Slido may be included in a publicly accessible recording of this workshop. So yeah, as I've said, we use Slido as our main sort of interactive tool in this workshop. So you can join Slido by popping onto your phone and going to slido.com and entering this code that's on the screen. Alternatively, you can just sort of hold your camera open on the barcode that's on there, and it will take you to the Slido. So I'm going to give people a chance to join on there. We really encourage people to join because we feel it makes the workshops interactive, and we just feel you get a bit more out of it this way. So I'm going to give people a minute to join, but just to say the next few slides are using Slido, and the code is still going to be on there, and anytime we ask you a question on Slido, the code will come back up as well. So if you miss it, or if anybody ends up joining late, that will still be available there. So I'm just going to move on, but again, the code for Slido will still be on here. So we just wanted to ask a few questions just initially that we do at the start of all our workshops, just to get a bit of an idea of who's attending tonight. So just what age is your child or children? So we've got 6 to 12. Just helpful for us to sort of bear this in mind when we're going through this workshop with you. And thank you to everyone who's joined. Perfect. So you can see there's lots of people with some sort of younger children between 6 and 12. We've got a few people with between 0 to 6 and a couple 12 to 18, so it's really helpful for us to know. Thank you. Don't think those are moving anymore, so I'm just going to move on to our next one. So just curious to know if anybody attending tonight has attended one of our workshops before. Oh, we've got an equal split at the minute. Brilliant, thanks everyone. So yeah, welcome to this workshop. We're going to be talking about supporting our young people with obsessive compulsive disorder. This is our first time doing this workshop. I am from the Psychology in Schools team, so my name's Anna and I'm an assistant psychologist, and I'm going to be taking you through this workshop with my colleague, who I'm going to let introduce herself.
Good evening, everybody. My name's Amy. I'm a principal clinical psychologist, and I work across several teams, including the Psychology in Schools team. So welcome, everybody.
Brilliant. So yeah, I'm going to sort of be taking you through the first half of this workshop, and then Emmy's going to take over for the second half. But I guess just to say at the start, really, this is an introduction to OCD. OCD is a very, very big topic, and we've sort of tried to include sort of lots of introductions to different aspects around OCD. Just to say that parts of this workshop might feel really helpful to you, others might feel not so helpful, and that's completely okay. You might find that this really might be dependent on sort of the age of your child or the severity of their presentation. Just to say as well, obviously this workshop is on OCD, but we really want to acknowledge that OCD is very much on a spectrum, and that actually also you might have a young person who's presenting with sort of ritualistic behaviours or certain thought processes, but possibly, you know, maybe parts of this aren't going to feel relevant, and that's completely okay. But yeah, just really emphasising that this is a real introduction to obsessive compulsive disorder, and starting to think about how you can support your young people with this. So just a brief sort of overview about what we're going to be talking about today. So we're going to start off by talking about myths about OCD, because when we put this together, that feels really important to acknowledge. We're going to talk about what OCD actually is, the different aspects of that. I'm going to discuss a bit about what keeps OCD going. Then we're going to move on to talk about a bit about the prevalence, so how common OCD is, and a bit about why people might develop OCD. And then later on, we're going to talk about the impact that this has on families, and just moving on to some sort of tips and resources to help you support your young person. So just to begin with, as I said, we just wanted to sort of at the very start of this workshop really name some myths about OCD. It feels really important to name this. I know sort of I definitely feel through my work, I think OCD has a really, really high amount of myths about it, whether that's through the media, whether that's just sort of day to day. There's this real myth about OCD that all it is people needing to sort of be clean and tidy, and that's all it is to it, in sort of, you know, that typical sort of neat freak person. That's often how OCD is represented. And I guess we just really wanted to acknowledge that those myths are out there, and that OCD isn't just wanting things to be clean and tidy. It can be lots of other presentations. That's not to dismiss that for some people it can be about cleanliness and about things needing to be a certain way, but just really acknowledging that every person is different and everybody's presentation is going to differ quite largely. And just really naming that OCD can be about lots of other things, you know, for example, having a sense of control, but we're going to think a bit more about some of the themes that we see coming up in OCD as we go along. So just to start, before I talk a bit more in detail about what OCD is, we've got this video that hopefully is going to work and play. Which is basically just a video where kids with OCD are explaining what OCD is. We thought it was a really nice, really quick 1-minute video that sort of gives you an introduction to it from people who really do know about it.
OCD is Obsessive Compulsive Disorder.
It's obsessions and compulsions.
An obsession is an unwanted thought.
And then a compulsion is something that you have to do because of that feeling.
If something hits, it's like I hear something in this ear, I'd want to hear something in this ear. Or if something hits this hand, I'd want to hit it this hand.
I would have to do things in evens, like an even amount of times, like 2s or 4s, but I could not do 8. I'd avoid things that I thought were poison, which was like gum wrappers, litter.
There were like tiles in the hallway, so I had to like walk only on certain tiles, and then
I used to have to read the tags on my clothes a certain amount of times.
I'd turn the light switch on and off and on and off and on and off. If I touch the iPad, I'd have to touch my dad and like blink a certain amount of time so he gets the contamination instead of me. So I kind of sacrifice him.
You think once I do the ritual, I won't be thinking about the obsession, and then I'll feel better.
And then something else, OCD, like another OCD ritual pops up, and they're like, come on, seriously, I just got done with the last one.
So yeah, just a real brief introduction, which I'm going to talk a bit more about now. So really focusing on that idea that was spoken about in that video about what is OCD. So before we get into that, we just wanted to put a note on here just to say that OCD is nothing to do with strength of character or courage in our young people. OCD can be really, really difficult to separate from our young person because it can be so consuming and so big. So we just really wanted to sort of note that, you know, this OCD doesn't say anything about your young person's strength of character or their courage. But just to begin with, and it feels important to sort of note before we move through the workshop today, that OCD is anxiety based, and that's really key to sort of hold in mind throughout. We are going to talk about a little bit later on just if anxiety in general feels that it's quite a large thing alongside this as well, that we do have some more resources on that as a team, but just to hold that in mind as we're going through. So as the kids in that video sort of start to mention, OCD really has two main parts to it. So the first is obsessions, which is reoccurring and persistent thoughts, urges and images. So when we talk about obsessions, we're really talking about really intrusive, sometimes inappropriate thoughts. And what really characterizes them from normal thoughts is they are extremely persistent. And with someone with OCD, obsessions cause a real feeling of uncomfortableness, of distress, anxiety. And what we know is that when those obsessions occur, which really can be, you know, about lots of different things for different people, as we've already spoken about, what happens is when this distress comes and this anxiety comes, we feel that we need to do something to try and sort of resolve that feeling or get it to go away, which is where the second part of OCD comes in, which is compulsions. So compulsions can be repetitive actions or mental acts, but essentially what compulsions are is something that person is feeling driven to do to try and get rid of that feeling of anxiety that's being created by that obsession. So some examples of sort of repetitive actions could be having to walk in and out of a room a certain amount of times before they can fully go in. It could be having to wash their hands 10 times after touching certain items. Mental acts can be really, really difficult for us to sort of keep track of, which is kind of illustrated by the image on this slide. So mental acts are sort of things that we'd say are things like counting, maybe going over certain things in their head. And what we know with compulsions, and especially mental compulsions, is that, as shown by this picture, we only really get a very sort of surface level idea of what somebody with OCD might be doing mentally in terms of compulsions, because it can be really, really difficult for us to really understand and know how much they're doing if they're doing it mentally and we're not able to sort of see that directly. With obsessions and compulsions, they are going to differ significantly between sort of person to person, but we know some sort of main themes that tend to come up when we're working with young people with OCD. Some common ones are sort of fear of contamination, fear of illness to themselves or loved ones, or fear of harm coming to themselves or loved ones. But I guess the key point there is that it is going to be very different for each individual. There's no real sort of blanket theme that comes up, as much as the myths, as we spoke about earlier, like to sort of act as if it's all about needing to be clean. We know everyone is different. And also just holding in mind this idea that with these obsessions and compulsions, the sort of key characteristic of OCD is that when we have these obsessions, when they have those thoughts, whereas I might be able to have a thought and move on from it quite easily, I might be able to just ignore that. With OCD, it's almost as if thoughts have to equal action. They have to act on that thought with some sort of compulsion, and these sort of come as a pair, really. And just reiterating that point before we move on about this idea of important to hold in mind that your sort of young person is separate from their OCD, because we know that with all these things going on, it can be really consuming, and really key to try and hold this in mind as we try to support our young people. So we popped a slide in here just to sort of discuss what it might be like to have obsessions and compulsions. So we've taken some sort of information here from someone called Joe Wells' book, Touch and Go Joe. So Joe Wells is someone who has experienced OCD since he was a teenager. And he's written this book all about his experiences with OCD. It's a really brilliant book. But one of the things that he talks about in here is that OCD is really, really difficult to explain to someone else who hasn't got OCD. So he has this example in his book where he talks about, do not think about tomatoes. Try really hard to get all the sorts of bright red tomatoes out of your head. Why would you want to think about tomatoes anyway? Ignore the tomatoes and remove them from your mind. Now, when I read that out, I'm guessing that most people probably thought of tomatoes. And although this isn't an OCD thought, it's really trying, I think Joe Wells was really trying to get this idea that OCD thoughts get stuck in your head and that it's really, really difficult to ignore them. It's a bit like when you get a really sort of catchy but annoying song stuck in your head and you just can't get it out of your head. That's what we'd almost explain sort of OCD thoughts to be a bit like. They're not sort of regular thoughts that can come and go and you have quite a lot of control over. They feel like they're stuck in your brain. And I guess as we sort of go on to talk a bit more about different parts of OCD a bit more, I guess another way to sort of explain what OCD thoughts are a bit like is if you imagine sort of a nagging child. So imagine your young person has come up to you and they really want something and they keep sort of going on and on at you, and you eventually give in because, you know, you've got lots going on, it's just easier, and you sort of say, yep, okay, you can have whatever it is that you wanted, and that sort of solves it for the moment. But what we know is that that child is quite likely to come back and keep nagging for the same thing in future, or be wanting sort of more things to do with that. And we sort of just want to plant this idea that that's a bit what OCD is like. We have these sort of thoughts coming that are really persistent and they feel like they're really keep going and going and going. So eventually somebody with OCD is going to give in to that and we get that quick relief. But what we know is that in the long term, it doesn't lead to the best outcomes. And we're going to think a bit more about that in a minute. But first of all, we'd really encourage you to get back onto Slido and just have a bit of a think about what do you think it might be like for your child to have obsessions and compulsions, just really trying to sort of mentalise a bit about what this is like for your young person. Tiring, absolutely. We know that with different compulsions, but also obsessions, obviously with those thoughts, tiring, time consuming, it can be exhausting and it can take up so much of our young people's times. Overwhelming, absolutely. She gets frustrated, and I think this is really what we're trying to stress here. It can be really frustrating for that child, all these thoughts constantly, feeling that they have to do something. It can be really frustrating and tiring. It can feel worrying, absolutely. All-encompassing, constant, cannot move out of the rituals into now, absolutely. And I guess this is what we're really focusing on when we're talking about that idea of like a song getting stuck in your head. Whilst it's not an OCD thought, it almost gives you a bit of insight about that actually for our young people, these thoughts don't, you know, they don't get a break from it. It's constant, unable to switch off, absolutely. Could just see a couple more people typing, so I'm just going to leave it for a minute. When people don't understand and just think she's being silly, gets upset. Not everybody understands that for her it's real. Absolutely. And I guess that's what Joe Wells really talks about in his book, is that it's really difficult to try and explain OCD to somebody who doesn't have it or doesn't understand it. You know, rituals can be anything, and for our young people, that's, you know, what they have to do to get rid of that horrible feeling. But we know that for other people that can be really confusing and really difficult to understand. So I'm just going to move on. Thank you all for all those responses. It's really, really helpful and hopefully reassuring for you all to see as well that other people might be feeling the same. So moving on now. When we talk about OCD, one of the key parts that we talk about is this idea of the OCD trap, or sometimes we call it the OCD cycle. So it's this idea that with OCD, we tend to get stuck into this cycle. And I'm just going to talk it through with you guys now. And we've got an example on the screen, which probably is going to feel a bit more relatable to maybe sort of like an adult situation, but hopefully that's going to help you sort of understand that a bit more. So as we've already discussed, we know OCD starts with that obsession, that really intrusive and constant thought. So the example that we've used on here is constant thoughts about whether or not the oven was turned off, even after checking once. And I guess the main point just to make here is when we're sort of saying an obsession, it is really normal to have doubts. It's something that happens to all of us every day. If I've used my straighteners, I tend to, you know, have a second thought whether I turn them off, and I might come and check that. But after I've checked that once, I'm fairly satisfied with that, and I don't think about that anymore. So I guess when we're talking about an obsession, that's where we really differentiate from just normal doubt. So constant thoughts about whether or not the oven was turned off, even after somebody's come and checked it. And what we know about the obsessions is that they cause a real feeling of anxiety and distress that's really difficult to sit with, and really uncomfortable. And what that leads our young people to do, or in this scenario leads this person to do, is that they feel compelled to act on their obsessions, on their thoughts, to remove that discomfort that they're causing. So in this example, it's obviously the thought about, did I turn the oven off? Worrying about, you know, if I didn't turn the oven off, what's going to happen? Is the house going to get burnt down? Are people in the house? So this real anxiety causing this person to need to act to remove that discomfort. So this then results in a compulsion. So as we spoke about before, having to carry out an action in response to the obsession. So for example, in this scenario, it would be repeatedly checking to confirm that the oven is off, so possibly going to great lengths to do so, such as travelling home from work. So again, this is where we really differentiate from just sort of, you know, I had a bit of a doubt, I checked it once and that's okay, it's out of my mind. You know, maybe this person has already checked it quite a few times, but they feel that they need to go and check it a certain amount of times. And this example, obviously using that example of when compulsions can be really, really difficult, if this person had to leave work to go home and check that, to complete that compulsion, to get rid of that anxious feeling. Now we know that after somebody's had this compulsion and done this action, that they get a real sense of relief. You know, the individual experiences relief from that anxiety. You know, they feel that real sense of, okay, I've done that, that's okay. But however, what we know about this is that this response has been strengthened for the future. So that need to respond to an obsession with a compulsion to get that quick relief, that cycle has been strengthened for the future. So once this keeps happening, we know that people are more often to have to respond to their obsessions with a compulsion. And the more often this happens, it's sort of like, this is why we call it a trap, because it starts happening more and it tends to be harder to break out of this trap or this cycle. So this is really, really key to hold in mind with your young people who might be sort of having to do certain compulsions in response to their obsessions. So I'm just going to move on to this idea about the tricks of OCD, which comes from Dawn Huber. She puts forward these sort of three main tricks of OCD. So when we're talking about the tricks of OCD, what we mean by this is that OCD is really, really brilliant at playing sort of tricks on our brain, without us even maybe knowing. If your young people, you know, is presenting in this way, it's quite likely that these things happen and they're completely unaware of them, and that can feel really, really scary. But I think what we're hoping is that you knowing about these and understanding a bit more about them makes them feel a bit more manageable and a little bit less scary. So when we talk about tricks of OCD, I guess what we're really meaning is that it really does sort of manage to get a bit of a rap on our brain, and it manages to sort of give us some false information sometimes. So we've used an example of a visual illusion on this slide, the two arrows at the bottom, because this is what we really feel it could be seen as similar to. When you look at the two arrows there, the lower one, the line looks much shorter, and I can feel quite confidently looking at that. I would be quite confident to say, no, the line at the bottom is definitely shorter. But what we know is that this is a visual illusion, and actually if you printed those off, those lines are the same length. But our brain tricks us into thinking that actually they're different sizes because of that optical illusion. And it's almost a bit like that with the tricks of OCD. It's really difficult to sort of notice those tricks. So the first one that Dawn Huber talks about is this idea of sound the alarm. So what we know is that our brains are set to respond quickly when there is a threat, which we really, really need. That's a really important aspect of our brains. For example, you know, if I'm on holiday and I'm in the middle of a field and there's a snake coming towards me, I really need my brain to sort of automatically get me into what we call our fight, flight or freeze response. I need my brain to be pumping what I need to my muscles to be able to run away quickly. I need that oxygen and that glucose going to my muscles so that I don't even have to think about it. My brain just gives me what I need and triggers me to sort of run away and into that flight mode automatically. I don't want to be stood in that field sort of thinking, oh, there's a snake coming towards me. I don't really know what I should do here. So obviously that system is really needed and that's really important, but the difficulty with OCD is that it tricks people by sounding false alarms. So OCD tricks our brains into that automatic feeling of there's a threat that I need to respond to when really there isn't. And it's really, really difficult when OCD does this because it triggers those same responses in our body. So we really do feel as if we need to respond to these you know, OCD threats that our brain, or that OCD is tricking our brain into thinking are there. So that's the first one that Dawn Huber talks about. And I'm just going to pass over to Emmy to talk you through the rest of these.
Lovely, thank you for that, Anna. So we just talked about how the brain kind of keeps sending false alarms, a bit like pressing the fire alarm all the time. And Dawn Huber talks about the second trick of OCD, and she's called it the maybe game. Now, most of the time, people make decisions based on what's most likely, and often we don't have to be totally sure about things or totally sure whether something will happen to manage that. So you might have a thought, and this, I appreciate, might sound like a very random thought. We tried to very deliberately choose a random thought, so we're trying not to relate to one that maybe your young person might have. So you might have a random thought like, could there be a monkey in my bedroom? Not likely, but maybe. So that is kind of part of what OCD kind of tricks us to think. So OCD likes to trick us, frighten us, sometimes even waste our time. So OCD will say things like, maybe the monkey climbed through the window while I wasn't looking. Maybe it's made a mess in my wardrobe. It might be dirty. Maybe I'll get ill from it. So there's that real kind of sense of setting a doubt. So what it might mean is that OCD will make us do things and tell us to do things as a way of keeping ourselves safe. And you end up checking whether there is a mess in your wardrobe, but then maybe you'll also check every time you're back in your bedroom. And then maybe you'll start checking the whole bedroom for this monkey mess. You may even create a set routine to be really sure there isn't any mess in the bedroom. And it can sort of lead to it taking a really long time. Maybe you have to start again if somebody interrupts you. So maybe when mum or dad calls to say, actually, dinner's ready, you know, you're partway through that routine and you might have to start all over again because you've lost your place in that routine. So that kind of maybe doubt can kind of really quickly escalate into bigger things. So, and that's what OCD is really good at. OCD is really good at making us doubt ourselves. So that's the OCD maybe game, as Dawn Huber sort of calls it. You think about what might happen, even though it's not very likely, and you have to do something to protect yourself just in case. So the next trick that Dawn Huber talks about is the disappearing just right feeling. Now, we usually don't think too much about everyday things like how our hair feels on our head, how our socks feel on our feet, or when we walk into a room and into another room in our own home. Those are things we don't often think about too much about. So OCD can make the okay feeling, though, disappear. So that kind of feeling that things feel okay. OCD can make us feel like we have to do certain things to feel just right again. So an example of that might be that this might mean we step through the doorway back and forth 4 times because otherwise it doesn't feel right. Or we might adjust our hair that we've just put into bunches several times as it doesn't feel quite even or quite right. Or we might seek reassurance about things we already know because OCD is whispering, "Are you sure? Are you sure?" So it's kind of constantly placing that doubt and kind of making us feel that discomfort in a way. So this trick isn't about something bad happening necessarily. We sometimes think that OCD thoughts are all about something bad happening, so we have to fix it and save it. It's about not feeling quite right, this trick. They do the things to try and get that just right feeling back again, but really it's an OCD trick. So we've kind of spent some time thinking about what is OCD and how does OCD trick us? It's a bit of a bully, really, isn't it? So what we wanted to then think about is the prevalence of OCD. Now, research suggests that between 1.9 and 3% of children have OCD. Now, if we think about a typical secondary school of, say, 1,000 pupils, between 19 and 30 of them may have OCD. And what the literature tells us is that actually it's an illness that affects children from all walks of life. So not dependent on social or ethnic backgrounds or particular social groups. So people are equally as vulnerable to developing OCD. And we also know that studies are showing that the COVID-19 pandemic has worsened cases of existing OCD and is related to higher cases of OCD in children following it. So in services, we've seen a massive increase of OCD related referrals, but also worsening of symptoms in those that are already referred in some cases. So we might have the question, why do kids get OCD? Well, actually, the literature isn't really that certain, and we can't really be sure what causes OCD in children. But there have been several suggestions. So the kind of quite obvious one is a genetic kind of suggestion. So sometimes we have families where a grandparent or a relative or somebody else in the family has had OCD or has OCD. There's also some environmental and social factors. So the COVID pandemic being one of those. But I think the thing to hold in mind is that it's actually nobody's fault. All you can do is offer support and perhaps help them with overcoming OCD if they would like you to. And that's a really key thing to hold on to. And we will come back to that. Oh no, it's done it again, has it? No, it's there. Brilliant.
That's
Okay, so we've got another Slido next. And the question we'd like you to think about is, how do you find OCD impacts on your family? I can see somebody typing. And I get this is a really big question, but our next sort of focus will be about how it affects families. So we can be late leaving the house, yes, we can really make you delayed because things take a really long time maybe. Stressful and doubt yourself if you're doing the right thing. Absolutely. Yeah, it can make us feel quite helpless sometimes. Lengthy routines that can add hours to bedtime. Oh goodness, yes. And we're really quite tired at that point as well, aren't we? Really gets me down as a parent. Yes, absolutely. My daughter's so consumed by anxiety that it controls what we can and can't do as a family. Yes, so a really big impact on our relationships and functioning in families. We will talk a little bit more about that in a minute. Causes frustration and upset, especially at bedtime. Yeah, and I'm mindful that it's probably bedtime or nearly bedtime for quite a few of you, your children as well, possibly. And totally change plans. Yeah, often have to return to the house to just check. Yeah, so Anna's already talked a little bit about that kind of having to go back and forth just to check something's quite right or are okay. Prevents us from going to different places or having to cut things short. Okay, so it gets really stressful and has a really big impact on your family. I see one more person typing. Oh, couple. So there's some really good examples of different ways it affects families and the impact it has really already. Just want to give the last few people a chance to put their comments. Okay, takes attention from both parents. Yeah, leaving my other child to occupy themselves. Yeah. We end up sitting up late, often into the small hours, to give reassurance and talk things through. This is almost daily at times and can be exhausting. Things take more planning, can't do anything spontaneously. So absolutely, thank you so much for sharing some of those kind of experiences.
And sorry to interject, Emmy, just
okay.
to say that hopefully, I know that somebody mentioned earlier that something that's really difficult is people not understanding, you know, maybe some of the things that your young person has to do. Hopefully people sort of in this workshop sharing all these experiences hopefully makes you feel a bit less alone with that as well.
Absolutely, that's a really good point, Anna. Thank you. Okay, so we wanted to focus a little bit on how does OCD affect families. OCD can and does affect everyone in the family, and the way it does can differ. We can also feel helpless as parents and express this via frustration. So some of you have already mentioned a little bit around that. We know it can feel frustrating if your young person is not ready to change as well. So that's a really difficult kind of dynamic that we often see in our work, Anna and I, is where the young person's just not ready to do it. But you as parents are so exhausted and frustrated and really want things to change. You might at times want to rescue your child from OCD, and at other times you might feel like screaming with frustration or anger at OCD. So you might have this whole kind of emotional roller coaster going on sometimes. We can also feel helpless as parents and express that via frustration. And it's perfectly normal to feel angry, frustrated, and upset by OCD because it's had such a big impact, which you've already talked about a little bit. And I can genuinely say Anna and I haven't met a parent yet who hasn't kind of felt frustrated and struggled. But the kind of thing to hold in mind is that communicating that to a young person isn't likely to be helpful, but it's a real struggle not to. And we really don't expect perfection. I think, you know, if we were in your shoes, we'd very much be in a similar position and we would struggle not to share those emotions. But it's just about being really mindful about that. So the importance of mutual patience. Now, it's really important for families to be patient and supportive of the young person, of course, and that sounds really simplistic and easy. We want you to be supportive in the fight against OCD, but it's also about the young person being patient with you as a family, because you might be really struggling to understand what's going on for the young person and what their experiences are. So like Joe Wells talks about in his book, you know, it's really hard to explain it. You know, the closest thing we got to was the tomatoes example, you know, how you might get stuck with that thought when you're trying not to think about it. So it can be really frustrating for families as they want to help the young person and want to help them overcome OCD. But the young person really has to feel ready to take that battle on to fight against OCD, which is really not an easy task. So the key bit to kind of think about is let your young person know that you're there to support when they are ready to fight back. So your family may feel angry and frustrated with OCD. People may feel sad about how difficult OCD can make life for the young person. Some people may think the young person's weird and ignore them and or they have OCD. And that might not just be family, that might be peers at school. Some people may not even know that the young person has OCD. So Anna was talking about those mental kind of compulsions. They might not see it, but you might see so much of it at home. The young person may feel that their family are upset and angry with them rather than the OCD. So I guess we can often get into those dynamics of frustration and that cycle of interacting that we can actually send each other false messages in that process as well. Okay, are you able to move us to the next slide, Anna? Lovely. Now, we've called this slide Things We Lovingly Do That Feed OCD. And we're really keen for you to know that this isn't about sort of assigning any blame at all. We naturally want to help our children feel better. That is why we often do some of the things that we do as parents. But we know that those kind of things that we lovingly do are also likely to continue those rituals and behaviours in your young person. But we totally get why you would, because we don't want our children to be upset. We want to kind of do everything we can to make them feel better. So often the kind of things we might get involved in doing is we can feed the children safety behaviours, as we sometimes call them, or rituals. And some ways that we take part in that OCD behaviour is by, for example, repeatedly answering questions like, will I be okay? And giving persistent reassurance when that's requested. Or we might be reassuring your young person who does lots of checks around locks and doors and appliances by checking they are locked and turned off for them. So it might be, mummy, can you just check whether that door's locked or not? Because I'm not sure that I've really locked it. And we'll go and kind of do that, and we'll reassure our child before they go to sleep and go to bed, for example. Or the other thing we might do, if our young person uses a lot of kind of products to clean items that are already clean, is we might restock the cleaning products for them on a regular basis, because we know that they kind of need to do that to kind of get through that. Or we might be promising family members they'll be okay in turn, which in turn keeps that OCD trap and cycle going. So they might be asking, you know, is grandma going to be all right? Is grandma going to be all right? And eventually, like that nagging child that Anna talked about earlier, we will give in, we'll give that answer, because it's really, really hard not to. And so we just wanted to put that slide in about how we can sometimes as parents get involved, but actually it's really understandable why you do sometimes maybe. Okay, we've got another Slido for you to think about. And what we'd like you to do is, do you notice yourself doing any of these things for your child? And can you try and give an example if you don't mind? We've got a few people typing. Reassuring her that she's not a bad person, absolutely. And it's really hard not to reassure on that point, isn't it? That's a beautiful example of where we really want to make our children feel better about themselves. I always reassure her that she's going to be okay. Yeah, another really lovely example. Shutting her bedroom door when she's not about. She always likes it shut so her little sister can't go in and mess her room up. Yeah, there's another dynamic to that, isn't there? The sibling. Yeah. So, but I guess also her fear about her sibling going in and making a mess and changing things. Reassurance, I think it will be okay. I hope it will be okay. Will it be okay? Absolutely. You can see that build up in that question, can't you? Sorry.
I was just going to say, you can almost see a bit of like a routine of how that has to be asked as well in that example, can't you?
Absolutely. Buying new cutlery and always washing clothes. Oh, yeah, that's exhausting. Buying large quantities of cleaning products. Yeah, reassuring that she has cleaned something so she can move into cleaning something else. Yeah, something having to squirt or spray cleaning products for her. Yeah, reassure her that she can put her worries on hold and get to sleep. Yeah, I do tell them things are safe when they ask and tell them again when they ask again, totally feeding it. Okay, yeah, you've been really honest though. So really love all your honesty in this Slido, really, because it is really tough, isn't it? But you're doing it from a loving position, so hold on to that, because it's not from a bad place. It's not because you're wanting them to feel better. So we totally get it. We've just got another person typing, and then we'll move on after that. Let's wait for a couple more minutes. Yeah, I put her shoes next to the others, but make sure they're not touching anyone else's, and tuck the laces in. Make sure the blinds are down. I do lots of things so that she don't get grumpy about them. Yeah, so you're kind of almost involved in that ritual, aren't you? And you're kind of having to do some of those rituals for her. Absolutely. And it's really difficult not to do some of those things if you've got lots of stuff going on as well, and you sort of think, actually, this is just going to help as well. Just got a few more people typing, and I just want to give them the chance, really. Let's give it one more minute. Okay, I go and count her teddies and make sure they haven't moved, even after she's already done it several times. Yeah. Yeah. Some really honest examples in there, isn't there? And I hope it helps also to kind of see, how other people are getting involved in some of the rituals or some of the struggles other people are having. That can be really helpful sometimes because we can feel really alone and frustrated with it. And lots of comments coming in.
Would you like me to move on, Emmy? Or we've just
Yeah, I think we might need to in a minute. Not going to places that she's associated with bad feelings. Okay. When she felt upset when we've been to that place previously. Okay, that's an interesting one. Okay, we're going to move on if that's okay. And I totally appreciate you might have lots more things to say. So what we wanted to think about is kind of you as parents, really, or caregivers. And one of the things we wanted to start thinking about with you is kind of being aware of our own emotions. So we've talked about the impact it has, the kind of involvement it can have, and how consuming it can be. So the key bit is to kind of be aware of our own emotions about OCD and you may be and what you might be communicating to your young person. So being really mindful about that. So what we might what we might like you to sort of try and think about is whether there's somebody you can talk to that you can trust about your own emotions, where you can kind of just phone a friend or somebody that where you can kind of just express those emotions and share those rather than communicating those with your young person, if that's possible at all. And the key bit that we often talk about when we have distressing experiences with our young people or things that become really challenging is the importance of also looking after yourself. So it's important that you have a full energy sort of feel, really, that you kind of have replenished your kind of fuel tank almost. We can't drive a car on empty. And it's the same sort of thing about supporting our children, really. So it's important we look after ourselves and kind of recharge that fuel tank to be able to support our young people with OCD. Sometimes we might have to ask for some help when you need it. You might find support from extended family helpful, but only if that really doesn't add to your stress, because some families are really supportive and can be really helpful, whereas other family members, you know, who might not get it, you might find that really stressful to talk to them about it. So it's very dependent on your families, really. You might need some professional support. So your child might need a therapeutic intervention. But we also know that accessing services can be really hard. Some of you might already be waiting for that. Some of you might not be waiting for that at all at this point. You might be at very different stages at this point. Remember, you don't have to be perfect. I think, you know, as a team, we're really keen to kind of sort of say that to you. Don't have to be perfect. Be kind to yourself and have really realistic expectations. You know, you're not going from a day filled with rituals to suddenly we're not going to have any. That's quite drastic, really. But maybe think about choosing your priorities really carefully. If you're having a really terrible day and it's one of those really particularly stressful days, let some things go. It's okay not to kind of hoover your living room that day and have 5 minutes to refuel your kind of energy tank, really, if you want to call it that. Maybe having that cup of tea, having that phone call with a friend, something that helps you recharge, really. And the other thing we wanted to sort of advise is focus on things other than OCD in your child. Often when we have young people with OCD, we become so focused on them and their OCD, whereas actually it's a part of your young person, but it's not all of your young person. It can feel like it's all of your young person sometimes when the kind of amount of rituals are so entrenched, it has such an impact on your family. But there is also another side to your young person. It's not your child, the OCD, really. It's your child who has OCD. Okay, so remember, while it can be really hard for you to witness the OCD, and it is really tough, isn't it? We don't want them to be distressed. We don't want them to kind of spend hours doing some of the things they might be doing, but it's harder for your young person with OCD. Okay, so some other tips to kind of think about when we kind of want to support a young person. Thinking about positive narrative that your child can do this and that you as parents can do it. So really think about that narrative we have. So kind of how we talk about it. You know, we get entrenched in that negative cycle of OCD ourselves. And some of you have given some really good examples of that earlier. Create a space to talk. Try and find a time to talk when everyone's calm or as calm as can be. Sometimes not everybody gets to that really calm point. And OCD is not bothering the young person as much. So we know that sometimes people have so many rituals that it's quite hard to choose that moment. But maybe kind of, you know, some people talked about bedtimes being particularly triggering and difficult. You know, maybe that's not the time to talk, but it might be an earlier point in the day. So try to remember to take a position of compassion and understanding, which is really hard when you're in that emotional roller coaster when talking to your young child. So really kind of be mindful of your kind of emotional stance and position, but try and find that scope for compassion and understanding. We know that OCD can affect many aspects of your young person's life and family life, which we've talked about already, and you've given some examples around, and can have adverse effects on relationships. Now, relationships, we all know, are really important in helping us feel good about ourselves. Improving relationships and spending time with people we care about, as well as doing things we enjoy, can increase the possibility of us feeling better in ourselves, but also helping young people overcome OCD. So if you kind of think, actually, the times we connect with somebody, we have that great time, it makes us feel better. The times when we're really focused on some of that, you know, if we're over focused on some of the difficulties, actually we become really entrenched in that narrative, and often it doesn't make us feel very good. So what we're trying to say is try and avoid that negative cycle of frustration around OCD. And, you know, that is difficult to achieve, and you probably will kind of fall into it even when you try not to. But it can negatively affect the experiences of relationships. Now, we don't expect you to be absolutely perfect at this. You are just human beings, just like Anna and I are. And, you know, we are going to fall into that trap and kind of in that negative cycle sometimes. But I guess it's just about sort of trying your best around that. And it is also really normal to become frustrated sometimes. So the other thing to kind of think about is, you know, a lot of you have talked about actually the constant reassurance giving that you might get involved in. And I guess it might be about thinking, are there ways to reduce that reassurance giving, even just a little bit at a time? So rather than just kind of stopping all the reassurance giving, maybe, is thinking about how can I reduce the amount I give? Because what we know is it can feed the OCD and make it bigger, but it is so hard, especially when it's bedtime and you want your young person to go to bed and have a good night's sleep. Okay, now one of the things we sometimes do therapeutically is we use something called externalizing. Now, we thought actually externalizing is a really nice way to have a conversation. So the idea about externalizing is that it helps to draw out something for us to kind of look at and think about and understand. So it might be about drawing out OCD as a character, and it can help us talk about and challenge that OCD. So in this lovely example on the picture, which is taken from the same website as we had the video from the children who explained OCD to you earlier. It's a really good website with lots of information as well, which we'll give you the reference for at the end. So it helps sometimes to draw out OCD, maybe as a bully, as a character. And what it fundamentally does, it helps us to refer to it as a bully maybe, or as that particular character. It removes it slightly from your young person, because the young person will feel it's so attached that when you ask the young person about OCD, it's really hard to talk about it and explain it. But sometimes distancing your child from it slightly and describing it as a character, or getting your young person to create a character, enables some of those conversations to occur. So it allows parents, professionals, and the child to team up and stand up to that kind of OCD bully. Okay, now we've talked a lot about what is OCD. We've talked a little bit about the tricks of OCD. We've talked about the impact on families. And we've had some thoughts or some introductory thoughts about what you might kind of think about in terms of support, building kind of your strength as well in yourself to support our young people. Naturally, this is an introductory session, and there are a lot of different strategies we could talk about, but due to it being an introductory session, we were quite limited in what we were able to kind of offer you really on this webinar. However, we've talked about the OCD trap, the 3 tricks, taking time for yourself, separating the child from OCD, and a few ways of supporting the young person and yourselves really. So we've got a list of resources. So we talked about Dawn Huber earlier and the tricks of OCD. So the book's listed there. We've also got the Joe Wells book listed. Breaking Free from OCD is probably slightly for older ones. The Dawn Huber one's very much geared for younger children as well, but sometimes teenagers like it too. There's the website linked for the video and the externalizing image. The Psychology in Schools team also do other webinars. So if you've not attended some of the other webinars, there is an anxiety-based webinar we run quite regularly. And you can sign up to those on Eventbrite. If you feel that you have a young person who needs support from mental health services and haven't made a referral, there is also the Emotional Wellbeing Hub link where you can make a referral.
We're just going to go on to ask a few final questions on Slido. So I know we're approaching time, but if people can stay on just to answer those, it would be really helpful. One of the questions we are going to ask you about is, as Emmy sort of mentioned, this is an introductory workshop, and it was really difficult to sort of try and include as many sort of tips in terms of helping and supporting your young person as we could. and we are considering having a part 2 to this workshop with some more sort of direct ways of supporting your young person to challenge their OCD. So if people don't mind hanging on, just to let us know on the Slido whether that is something they would be interested in. But we've just got a few questions before we get to that. So what are 2 things you will take away from this session? We just ask these questions because it really helps us to we try and keep adapting these workshops. So we just like to know what people have found helpful, so that if we're adapting it, we don't sort of remove those at all.
Yeah, it helps us have really honest feedback. So
yeah, so please feel free to sort of be honest.
Got quite a few people typing. Okay, the opportunity to hear from others. It's good to know we're not the only ones to be going through this. Absolutely. While it's quite sad to hear people are going through it, it can also be really reassuring, knowing we're not alone, that we're not alone. Yeah, there's a real theme around that. The people who understand what it's like to live with, that we're not the only ones experiencing this. It was reassuring to hear other people's experiences, other parents' experiences, drawing the monster out. Yeah. That we're not the only family going through it. Don't feed the OCD by over reassuring. Yeah. Do not focus on OCD all the time. Absolutely great. Yeah. Try to work on reassurance. Try to help my child to find their own reassurance. Not to label my child is more than OCD. Yeah. More understanding what it's like for my child. Hope that there are strategies to help. Yeah. Ways to support our child that don't involve being a part of it. Yeah. Part of the routine, the OCD bully idea, just to be more aware, creating time to speak to the children, spending quality time doing things with them that isn't focused around OCD. To think about spending more quality time together and not focusing on OCD so much. And I know earlier somebody talked a bit about actually we sometimes do nice things and we have to cut it short. Don't give up on that, because it's really important that you try and do that nice thing still. But we also wanted to appreciate that, it is also a juggling act with other children in your households, maybe. And we didn't focus that much on that today. I'm
just going to move on just to ask if people have found this session helpful. Again, please feel free to be 100% honest. It just helps us keep trying to improve these workshops. Just going to give it another minute to give people a chance, but I'm conscious that I know we are over time now. Perfect. I can't see anybody else responding.
Okay, we did give it until 15:15 if we needed to, Anna, I think.
Oh, did we? Okay, brilliant.
Yeah. So we weren't sure if we could do it in an hour, were we?
Thank you, dokes.
Lovely. Thank you so much for that feedback. Should we have the next slide of things about the part 2, isn't it?
Yeah. So just going back to that idea that when we were sort of putting this workshop together, we were keen. There is lots out there and lots that we sort of wanted to include in terms of more specific ways maybe to support your young person to challenge, specific parts of their OCD if they're feeling ready to do that. So yeah, just really helpful for us to sort of see if people feel that's something that they would be interested in attending.
Yeah, that's great. That's really helpful feedback.
Really helpful. Thank you.
So is that our last slide, Anna?
I believe it is. So that's the end of the workshop today. I guess we just wanted to say thank you all very much for coming along. And I guess just a final message of saying that everyone is doing a brilliant job. I think you can all see from the Slidos that everybody who's experiencing it is finding it difficult, but you're all, doing the best that you can, and that's what you can do.
I just want to say thank you to everybody for taking part on Slido as well when you've been able to, and for some of your really honest kind of comments and sharing of your experiences. It really helps other parents as well, which is really kind of reflected in the feedback we've had this evening. I think it's just that not feeling alone, and it's so hard to get other people to understand and feel compassionate and understanding towards us as a family, let alone our young person. So thank you for all your sharing.
Okie dokes. Thank you very much, everyone.
Thank you. We hope you have a good evening.